Well, as Europe, the UK, and the US race to vaccinate their populations against COVID-19, Africa has so far secured only 1/5 of the vaccination doses that the continent needs. The African Union says it has secured 270 million COVID-19 vaccine doses, which will be made available this year. Now, this will supplement the 600 million doses obtained by the WHO's COVAX Alliance for Africa. But some African nations, they aren't willing to wait. Guinea, for example, is now testing the Russian vaccine Sputnik V and has ordered 2 million doses. South Africa has ordered 20 million doses of the AstraZeneca vaccine, and Kenya has ordered 24, which should start arriving by the end of next month. Now, that's not soon enough for many health workers, though, who feel that they have been exploited. They've gone on strike to demand better pay, medical cover, and adequate protective gear. The government is playing down their concerns and threatening to fire those who strike, as DW's Mario Muller reports from Nairobi.
Dorcas Mogore loves her job as clinical officer. A big part of it, though, was to work closely with COVID-19 patients. Then one day, she got sick herself.
I survived COVID. I went through a lot of problems. After I was infected, I didn't have a medical cover which could cover my bills, and I got so sick. I was supposed to go on oxygen. Both of my sons were infected too. It was very traumatizing.
She survived. 9 of her colleagues did not. And then another shock. She had to pay the expensive hospital bill from her own pocket. For over a month now, she's been on strike. With her, nurses and medical lab officers, more than 30,000 healthcare workers, according to the unions. Their demands include protective gear, health insurance, and compensation for families in case of death.
If any of us is to die from coronavirus today, their family is going to live in destitution. And as if that is not enough, then they tell you if you do not go back to that unsafe working environment, we are going to sack you.
Indeed, healthcare workers across Kenya have lost their jobs for participating in strikes the government says are illegal. We put the healthcare workers' demands to the Cabinet Secretary of Health, Mutahi Kagwe.
We have more than enough PPEs in this country. Since October of this year, we have got the most generous insurance package that has ever been given to the civil servants. They do have some legitimate issues that they have raised with us. For example, delays in their payments and so on.
The reason for those delays, says the health minister, is the current economic situation.
Nobody is denying that you should be getting your money. You should. It's a legitimate right. But we are also saying that when there is this situation in the country, let's also face it together, and don't make it look like you are blackmailing the government at its weakest point.
As Dorcas doesn't feel protected by her employer, she's awaiting the COVID-19 vaccine. Kenya expects to receive the vaccine through the COVAX facility, among other sources. But experts say a 60% vaccination target is needed to achieve herd immunity on the African continent. Meanwhile, wealthy nations have reserved more than half of the vaccines, even though they're home to only 14% of the world's population.
So there is kind of some selfishness to say, let us first reserve enough for our people. I think the issue here is that global responsibility issue. So you can reserve as many as you want for your country, but what is your responsibility to ensuring the world is safe?
To be safe, that's also Dorcas' wish for herself and her colleagues.
How do you feel about that Kenya and other African countries get the vaccination later?
Yeah, we feel like we are less human. We feel like we are not considered. But anyway, better late than never. At least we are hopeful we are going to get the vaccination.
Kenya's first tranche of 24 million vaccine doses is expected to arrive next month. Dorcas now hopes the vaccine will finally ensure her safety.
And for more on this, let's bring in now Dr. Moga Kamayani. She is a global health expert and joins us from the UK. Welcome to the program, and thank you for being with us. We understand you've been campaigning for a more equitable distribution of COVID vaccines among rich and poorer countries. How do you think it can be achieved?
It can be achieved by increasing the supply of the vaccine, by maximizing production, which means that companies and research institutions share their technology and intellectual property, so other potential producers in developing countries and in other countries can produce more doses. And we should be fair allocation of the doses. So it's not everything in rich countries, but, as your report says, health workers all over the world should be vaccinated at the same time. This is a priority group, according to WHO.
Okay, so that's the solution as you see it. I'd like to ask you also about the current state of affairs, because we have the WHO chief has just been speaking. He said that the world is on the brink of a catastrophic moral failure. How dangerous do you see vaccination nationalism right now, and just what you're seeing transpire around the world?
Well, it is dangerous because on public health grounds, you can't really keep the virus at your borders. And we're seeing mutations already. So you keep the virus, outside, and countries with the other countries without vaccination, it means we'll have more mutations that might not be susceptible to the vaccine. So it will ruin the impact of vaccinating your own people, or the countries that are doing that. So on public health grounds, it's very dangerous. On economic grounds, you can't revive your economy. We're interconnected globally, and therefore, who are you going to trade with? Which tourists will come, or which business people will come to your country when there's no vaccination in their country? So it's very difficult from economic basis, and also it's morally wrong.
It's morally wrong, and it's also. I mean, we have to mention and just make the observation that, despite massive resources, massive money in countries, for example, here in Europe, where we are currently right now, the continent is still being ravaged by this pandemic. Just tell us about the situation elsewhere in other countries that might not have those resources.
Well, as you know, the virus has been going like in waves. So for the first wave, the infection rate in Africa wasn't as big, let's say, as in Europe. It was the second wave now. Infections is very high in all countries. It's much higher than the first wave in every continent. So in Africa, it's also getting high. In Latin America, of course, it's very, very high infection. Brazil comes immediately after the US in terms of the number of infections. So it's very serious everywhere. It's not sparing anybody, really. It's not sparing any country. So we need a mechanism to maximize supply, maximize fair distribution, fair allocation, basically, to all countries, vaccinating the at-risk groups, the priority groups, health workers, old people, other groups, until you end up vaccinating everybody, or at least vaccinating the majority of the population to achieve herd immunity, and therefore really control the virus. Without herd immunity globally, we can't control the virus.
Dr. Mogul Kamalyani, a global health expert, thank you so much for joining us to share that insight.
Thank you.